we're exposed to everything. I'm not a killer. I got 2 years to come home, and I might not make it home.
We know that 7 inmates have tested positive.
As of yesterday, 365 prisoners and 99 staff at that facility have tested positive.
So far, 230 detainees have tested positive.
3 inmates have died.
You have all these people locked up, and they're sitting ducks. It'll spread like wildfire through these settings.
The COVID-19 or the coronavirus is pretty scary because it's new, and it's nothing that we've really prepared for.
In the early stages of the COVID-19 pandemic, experts warned how dangerous it would be for prisons in the U.S., where nearly 2.3 million people are locked up, the most in the world. Many of those are behind bars because they can't afford bail, they violated parole, or they're awaiting trial. Over the last month, I spoke regularly with dozens of inmates and their family members who have been anxiously bracing for outbreaks in their prisons and urging authorities to respond.
I'm one of the part-time janitors here. There's nothing proper here to clean with, nothing. If I contract it, I'm pretty much a dead man.
The officers and civilians are still coming in and out of the facility. As of yesterday, we just found out that 4 people here actually have tested positive for the virus. So
there is a palpable concern versus last week with the increase in cases and the media coverage seeming more and more dire.
Can you hear me?
Yeah, I can hear you.
My name is Keziah Norman, and unfortunately, my husband was incarcerated. So when this COVID-19 situation hit, I was actually watching it unfold in China, and I was like, hey, this seems like something that's really serious.
By the time I first spoke with Keziah, there were already more than 500 reported deaths in the U.S. from coronavirus, with new cases being confirmed in jails and prisons every day.
I mean, something has to be done, because are we going to literally sit around and watch millions of people's family members die right before our eyes and act like this doesn't exist?
Whenever Tavariel calls you to patch me in again just for a few minutes for a quick update.
Hey, Tavariel, how are you?
I'm okay, Michelle. How you doing?
How are things going in there?
60 people in a dorm. They're literally like a foot apart from each other. So there's no way I can quarantine myself from anybody else. But it's like a cubicle at work. When you're at an office and they have the cubicles, that's the same thing we live in. It's crazy. Like, it's real scary here. They're gonna stop recreation where people go out to the yard and to the gym to work out. A lot of people don't believe that this is something serious, so they look at it like a joke.
This is a new virus to the human species, so everyone's vulnerable. So it's really a matter of exposure. It's not the population per se that's the problem, it's the setting that they're in. I've been to Rikers Island, I've seen what it's like. You cannot contain this in Rikers Island. You cannot contain this in most correctional facilities.
The virus is indeed spreading inside Rikers Island, the New York City jail with notoriously poor living conditions. The vast majority of people there are detainees who have not yet gone to trial. Over the last 12 days, the number of confirmed cases there ballooned from 1 to 200. I talked to Marlene Allo, whose son is inside.
I have a son who has an acute lymphoma leukemia cancer, who's currently incarcerated in Rikers Island at the North Infirmary Command. He's a pretrial detainee awaiting trial. I've been watching the news literally from like morning to night because I want to know what's going on. And being that my son has a low immune system because of his cancer, and he goes to the hospital every 30 days to receive chemo, God forbid if he were to get it, he wouldn't stand a chance. His body cannot fight it off.
Half of people in prisons and jails in the U.S. have at least one chronic condition. The problem is they're all going to get infected at once because it'll spread like wildfire through these settings. So the first thing we can do to prevent this is to get as many people as you can out of those facilities.
Across the country, some officials are announcing they'll release a limited number of inmates, but the releases are happening slowly and mostly on a case-by-case basis.
I would like my son released right now, and they can even put a bracelet on his leg if he's got to stay in the house, and then when this is over, he can go back. Because there's no way with the conditions of the jail and everybody is in such close proximity of each other, it's like a death sentence in there.
So we have a very narrow window of opportunity right now to let some people out. And frankly, I don't think we can do it. So then the next step is, how do you prevent it from coming in?
Some states are refusing to reduce their inmate population, including Arizona. So jail staff there, like Nurse Brittany Quinn, are focused on making sure no incoming prisoners have the virus.
And we put into protocol that we were going to screen everybody prior to entering the facility. Once we started putting protocols into place, we had an officer or a nurse, if a nurse was on staff, go out in proper PPE. So I wear gloves and an N95 mask and do a corona screening.
As I'm sure that it has a long incubation period and people can also be asymptomatic. So are you worried that these standards might not be enough to keep something like this out of the jail?
Yeah. Once it really gets into the walls of the jail, we're not really going to be able to stop it. We're going to have to quarantine them all because one pod of 50 people shares air supply.
Kurt Bagby is the undersheriff at the jail where Brittany works.
Can you hear me now?
Yes.
Jails aren't really built to separate people with any type of airborne, bloodborne pathogen or whatever. You can be holding thousands of people, and they depend on us for their safety and their well-being and all of that. The COVID-19 or the coronavirus is something that is pretty scary because it's new and it's nothing that we've really prepared for.
Hey, how's it going?
I'm very scared. I understand that I got myself in this predicament, but I'm not a killer. I got 2 years to come home, and I might not make it home. And this is crazy. I got a wife, I got a son, and I don't think it's fair that I should be put through this, and I might never see home. And, I didn't rape anybody. I didn't shoot anybody. I didn't kill anybody. I just want them to know that. I would like them to know that even though we're incarcerated, we're still human, and I don't think our lives should be put on the front. We're exposed to everything.
I think he's handling it well, but I do feel that he is really depressed. And when I'm talking to him on the phone, I'm not letting him know that I fear for him, that I'm scared.
You gonna be all right in there?
Yeah.
I miss you so much. Be safe.
I am currently in New York City, and the amount of sirens that you hear, they're going off every maybe 10 minutes. And the hospitals are packing up. It's the type of thing where it's you would want to say, okay, let's just hope and pray. But it's this is kind of closing in on you.
Hey, can you see me? No, not yet.
It's March 30th, and more rural communities are reporting confirmed COVID-19 cases. I'm checking back in with Brittany, the nurse at La Paz County Jail. She's not feeling well and is worried she may have the virus.
I went into the urgent care on Friday. The nurse practitioner came in. He's like, nurse to nurse, I'm pretty sure you have it. He's like, but we can't test you because apparently our hospital right now isn't testing anybody that isn't hospitalized or a hospital employee.
But and they told you can't get tested even though you yourself are a healthcare worker.
Correct. And the fact that they denied me knowing what my occupation was a little disturbing, but I feel like this virus is really just a beast. They've started limiting our shifts to where it's not a fully manned shift anymore. They're basically running with the minimum amount of officers that they can to safely run the jail to minimize exposure. Italy warned us talking about New York, and we didn't listen. And I truly feel that in a couple of weeks, we're going to say that you guys warned us and we didn't listen.
The virus is also hitting prison guards and staff. Several corrections unions have filed lawsuits against state and local governments for failing to protect them.
The PPE is not offered to the work staff who work there daily, not even to our members who have direct contact with inmates who test positive for COVID-19.
It is early Saturday morning, and I'm about to give Marlene Allo a call. I got a text from her last night asking me to give her a call and that she had heard from David and that it wasn't good.
Hi, how are you?
I'm good, Marlene. How are you doing?
I'm not good today. They took David out of Rikers Island last night. They took David out of NIC. They brought him to Manhattan to the Tombs. He has shortness of breath. He has pains in his chest. They don't have his medication there. He said he's around everybody that has the coronavirus. Kill my son in there. They're going to kill my son. They're going to kill him. He said in one part of the building that all the people have the coronavirus and the guards are working over there and they're coming to him, giving him food with no mask, no gloves, no nothing.
David is one of thousands of inmates with high-risk health issues hoping for temporary release or transfer to home confinement during the pandemic. Their situations are getting more urgent as outbreaks and deaths increase in correctional facilities across the country.
And I know that a lot of people are going to get sick and a lot of people are going to die. We didn't act quick enough to prevent all these infections happening at once.
I'm not expecting for you to let the whole population out, you get what I mean? But at the end of the day, I mean, try to start, let some people go. I mean, even the elderly, what is the real reason for keeping us in here if we don't pose a threat to society?
This is basically Wisconsin's new death penalty, because he's not releasing any prisoners who have medical conditions or have less than a year to go.
COVID-19 gives us the opportunity to expose what's really been going on.
The officers, they're starting to walk around with masks. What it is they're scared. They're starting to act like, me and everybody else that's locked up who's scared that they might get this. Everybody's starting to take it serious now, but now you're taking it serious. It's too late. It's here. I still have not left my dorm yet because I'm still too scared to go out. This is the most scariest thing. I still stay in my bed with my covers over my head. I'm on death row, and I didn't do nothing to get here. And the scares out me.